Hi, this is Dr. Rajeshwar from YR Pharma Tube. In the previous video, we discussed the history and development of tetracyclines. If you did not watch the video, hit the I button on top right of this video to watch it. For the other topics of antibiotics and medicinal chemistry, click on the links given in the description below this video. In this video, we shall learn the structure, nomenclature, classification, and clinical uses of tetracyclines. Structure of tetracyclines. The tetracycline nucleus possesses 4 linearly fused rings labeled A, B, C, and D rings. It is the naphthene ring family of organic polycyclic hydrocarbons. Naphthene rings are numbered starting at C1 on the A ring, moving clockwise, where all skeletal and exocyclic carbon atoms receive a number designation. Bridgehead tertiary carbon atoms receive both a number and a letter designation. The tetracycline nucleus is perhydrogenated, where only the D ring retains aromatization or aromatic in character. The basic tetracycline nucleus, possessing all of its hydrogens, is named by convention 1, 2, 3, 4, 4A, 5, 5A, 6, 6A, 11, 11A, 12, 12A dodecahydronaphthene, and it is essentially a flat planar molecule with little molecular dynamicism, possessing both alicyclic alkane, that is the A, B, and C rings, and aromatic character in ring D. Major changes in the structural and molecular character of the tetracycline nucleus occur by the introduction of the 6 oxygen functional groups into the lower region of the molecule and to the C3 carbon along with a dimethylamine group at C4, producing the compound sancycline. Sancycline is the simplest tetracycline with the most basic chemical structure needed for activity in prokaryotes, while eukaryotes and their macromolecular targets can be affected by the 4 D-dimethylamino derivatives of tetracyclines, that is, those lacking the C4 dimethylamine group. Introduction of the C10 phenol, the C11-12 ketoenol substructure, the tertiary hydroxyl group at C12A, and the C1 ketone in conjunction with the enolate ion formation at C3 adds dynamic structural attributes to the molecule, changing the naphthene ring to the structure as shown, where the A ring is bent upwards at the angle about the C4A C12A bond. Sancycline and 4-D-dimethyl sancycline display a similar 3-dimensional shape to that which was obtained from oxytetracycline through X-ray crystallographic methods. The presence of the highly dense oxygen functional group system has an impact on the physicochemical and 3-dimensional properties of the naphthene ring system, and it is the major region responsible for the pharmacological properties of the tetracycline family. Along the lower periphery of the ring system is the pharmacophore region, the area of 3-dimensional spatial arrangement of atoms that convey binding affinity to biological molecules and receptors, and it is the area most sensitive to chemical modification. Tetracyclines, in particular oxytetracycline, have been shown to exist as an equilibrium of 2 different forms based on solvent environment, although this view is probably simplistic. Hydrophilic phases favor the formation of the zwitterionic A form, whereby proton transfer between the 3-hydroxy group and the neighboring C4 dimethylamine occurs to form a twisted charged species. Conversely, an unchanged lipophilic form occurs, that is the B form, which causes the overall structure to extend and become more planar about the C4A C12A axis. It has been suggested that both forms are required for bioactivity, at least in bacteria, where the charged form is required for binding at the ribosome and the uncharged form is responsible for crossing biological membranes. Both derivatives show the effect of each individual exocyclic oxygen and or C4 nitrogen atom and C2 carboxamide on the overall shape and therefore subsequent function of the tetracyclines. Modifications of the C1 and C11 ketone, C3 or C11A C12 enolization or the C10 phenol drastically change the structure to a more linear flattened or extended structure similar to the B form of tetracycline. The beta diketone structure between rings B and C and the process of tautomerization are extremely important for maintaining biological activity, whereby blocking of the 11A position causes severe twisting about the C5A C11A ring juncture, changing the structure from its normal angled shape. This molecular deformation occurs with C11A halogenated tetracycline derivatives, which inhibits the formation of the C11A C12 enolization and is inactive against both prokaryotic and eukaryotic targets. Comparisons and observations of the effect of its functional groups on overall structure suggest that the C4-D-dimethylamino tetracycline A form has a similar structure to the C4-dimethylamine A form. The superimposability of both tetracyclines indicates that the compounds would bind similarly to receptors and show equipotency against cellular targets and biological endpoints. Both compounds sancycline and the chemically modified tetracycline C4-D-dimethylamino derivative have been studied both chemically and biologically, and the data can be readily compared in biological models. Nomenclature of tetracyclines. Tetracyclines are named according to IUPAC convention and the substituents found at the various positions along the naphthene ring. Thus, sancycline, which is the simplest tetracycline both chemically and biologically, is named by convention as 4-dimethylamino 1,4,4A,5A, 6,11,12A octahydro 3,10,12,12A tetrahydroxy 1,11-dioxo 2-naphthene carboxamide. Other IUPAC tetracycline names for several clinically significant tetracyclines are shown here, where the changes based on the nomenclature of sancycline are mentioned in bold. Stereochemistry located at the chiral centers within the tetracycline nucleus is denoted within the chemical name, where the orientation is added as S or R depending upon its three-dimensional spatial arrangement. The designation of the alpha and beta orientation depicts the spatial arrangement of two possible diastereomers of the C4-dimethylamino group, the alpha derivative occupying space below the plane of the naphthene ring and the beta orientation occupying substituent space above the plane of the ring. Carbon atoms 4, 4A, 5, 5A, 6 and 12A are potentially chiral depending on the substitution. Oxytetracycline and doxycycline, each with a 5-alpha hydroxy substituent, have 6 asymmetric centers. The others, lacking chirality at C5, have only 5 chiral centers. The IUPAC designation for minocycline now shows the stereochemistry, where the designations are bolded and mentioned here. There are more basic ways to name tetracyclines and their derivatives, and one will find these interchangeably within the scientific literature. By taking the core structure of tetracycline and then removing and or adding functional groups, the derivation of simple chemical names for the tetracyclines is possible. For example, oxytetracycline, a generic name, can be described distinctively as 5-hydroxytetracycline. Demeclocycline is thus named 6-dimethyl 7-chlorotetracycline and demicycline is denoted as 6-dimethyl tetracycline. Sancycline is thus named 6-dimethyl 6-deoxytetracycline and so forth. This becomes important when describing the functional groups attached at the various positions, forming more complex derivatives. Classification of tetracyclines. Tetracyclines are classified into naturally occurring tetracyclines, semisynthetic tetracyclines, glycycyclines, and the newer drugs. Naturally occurring tetracyclines are chlortetracycline, oxytetracycline, tetracycline, and demeclocycline. These are marketed drugs obtained from Streptomyces species. Semisynthetic tetracyclines are doxycycline, minocycline, methacycline, limecycline, meclocycline, and rolitetracycline. Tigecycline is an example of glycycycline. The newer and recent drugs are eravacycline, sarecycline, and omadacycline. The duration of action of tetracyclines vary. Chlortetracycline, oxytetracycline, and tetracyclines are short-acting tetracyclines, ranging the half-life from 6 hours to 9 hours. Demiclocycline and methacycline are intermediate acting tetracyclines with the respective half-lives of about 12 and 14 hours. Minocycline and doxycycline are relatively long-acting and have half-lives ranging from 16 to 18 hours. All the tetracyclines are excreted in the urine and feces. Naturally occurring tetracyclines. The very first tetracycline antibiotic to be discovered was chlortetracycline produced by the Streptomyces aureofaciens. Next came oxytetracycline derived from Streptomyces rhinosus. The difference in the structures of these two antibiotics is that chlortetracycline has a chloro group at position 7 and in oxytetracycline there is a hydroxyl group at position 5. The third member, namely tetracycline, was first obtained by catalytic hydrogenolysis of chlortetracycline and soon thereafter by fermentation in low chloride media. Demiclocycline is also a naturally occurring tetracycline. It differs from chlortetracycline only by the absence of the methyl group at carbon atom 6. It is produced by the growth of certain strains of Streptomyces aureofaciens. Here are the structures of semisynthetic tetracyclines. Doxycycline, minocycline, and methacycline are semisynthetic derivatives. Others in this class include limecycline, meclocycline, and rolitetracycline. Tigecycline is a glycycycline and the newer tetracyclines are eravacycline, sarecycline, and omadacycline. Clinical uses of tetracyclines. The therapeutic importance of tetracyclines has declined over the years with the upsurge of resistant strains, particularly among enterobacteria and streptococci. They are still widely used for the treatment of respiratory infections, particularly chronic bronchitis and mycoplasma pneumonia, and in selected skin infections such as acne, urinary tract infections, brucellosis, sexually transmitted diseases. Traditionally, tetracyclines are the drugs of choice for rickettsial and chlamydial infections. Tigecycline is used as a second and third line antibiotic to treat more difficult skin and soft tissue or intra-abdominal infections. Tetracyclines are active against malarial parasites and some other protozoa. Doxycycline is sometimes used for anti-malarial prophylaxis and in combination with quinine in the treatment of Plasmodium falciparum infections. This is the list of references followed for the lesson. That's all in this video: the structure, nomenclature, classification, and clinical uses of tetracyclines. In the next lesson, we will learn the physical and chemical properties of tetracyclines. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.